Boom, sex is important and it's great.
I tell people, just because something is common or normal, because that's what normally happens, doesn't mean you have to accept it.
You look so happy.
I'm happy as a lark.
Are you able to have an orgasm? How's that going? Is it comfortable? They'll be like, yeah, but it's not during penetration.
Myth number 8, sex has to be spontaneous. This is personally one of my favorite topics to talk about when it comes to sexuality. Overall, there are different types of desire. Spontaneous desire, responsive desire, which means you get sexually aroused or your desire peaks or your sexual interest increases in response to your partner's cues, situation, and then contextual desire, which is also more of that situational piece. Most people have a blend of responsive and contextual desire. Very few people have spontaneous desire. And what we think of when we see movies or think about sexuality is that everybody has spontaneous desire and it should just naturally happen at any time. And the thing is that as we age, you may have had spontaneous desire in your teens, your 20s, maybe even in your 30s, but as you age, the type of desire that you have is going to shift and change, and that is normal and that is okay. And this is likely a result due to hormonal changes that naturally occur both in males and females, as well as anatomical changes that may take place, including erectile dysfunction, as well as vaginal dryness. And while those things are treatable conditions, sometimes the desire piece doesn't always follow once those things are addressed. And so it's important for you as an aging individual that you understand that it's very normal for desire to kind of ebb and flow throughout your life. And the other thing is that some people don't like to realize that sometimes we have to schedule sexual activity, just like you have to schedule going to the gym or schedule your vacation or schedule time off or schedule anything that you have to schedule. Sometimes you do have to schedule sexual activity. And some people think, well, it should just be spontaneous. But again, going back to that, thinking of sexuality more in a context of being responsive or contextual based on your situation that you are in.
You look so happy.
I'm happy as a lark.
And Christina, would you say that oftentimes, or sometimes I hear folks when they do get in a routine or a habit of scheduling it, even though they might not have that kind of spontaneous arousal moving into the date or to the schedule, once they get into it, they're like, oh, thank goodness, this is actually really wonderful. And then desire and arousal continue to sort of cascade from there. Would you say that's the case?
So that is definitely the case. And that is a sexual response model that came out in the early 2000s. It's called the Basson model for sexual desire. And so at any point in a circle, so it looks at sexual response in a circle rather than just in a linear kind of thing like this, which is the traditional model that we have used, and that you can enter the circle at any point in the circle. It doesn't have a start and it doesn't have an end. And so I think looking at it like that is different than looking at it like you have to do this and then this and then this. I mean, sometimes it's just about building intimacy and connection with yourself or your partner, and then things start to kind of flow in a maybe a natural, maybe not natural, maybe you kind of just have to play around with it. And the thing is that there's no right or wrong answer. It's whatever feels good, makes you feel good, makes you feel happy, healthy, and those sorts of things. Myth number 9. If your partner has a low libido, it means they don't find you attractive or they don't want to have sex with you. Again, not the case. If people have low libido or low desire, it could be from any one of those reasons that we just discussed: hormonal changes, concerns about anatomy, even concerns about pain. Sometimes that can be a cause that lowers our desire. And so a lot of times it has nothing to do with the partner themselves. And again, it's all about communication. So opening up that communication, both with your partner as well as with your trusted healthcare providers, to figure out what can be going on that can help you. Is it stress related? Is it fatigue because you're not getting enough sleep? Do we have some hormonal imbalance concerns? Do you lack body awareness? Do you lack awareness of where your pleasure areas are?
And I just want to make sure that our listeners know that there are really specific kind of almost homework or prescriptions that your healthcare providers that are trained in these things can provide once you can identify, or they can help you identify which of those things it might be. There's very clear and certain prescriptions for that kind of pleasure mapping, or for working on the tissue texture, the muscle tension, all sorts of things like that.
Yeah, we have lots of tools, literally and figuratively. To our myth number 10. Orgasms only count if they happen during penetration. So this is another really highly misinformed thing that's out there, in that penetration or orgasms have to come from penis and vagina penetration, which is absolutely false. Only 4% of women actually report having orgasms from intercourse alone, with or without clitoral stimulation, which means that majority of women actually need some form of clitoral stimulation in order to have an orgasm.
I hear folks, if I'm asking or talking about these questions about, okay, are you able to have an orgasm? How's that going? Is it comfortable? They'll be like, yeah, but it's not during penetration. Like, it doesn't count if it's not that way. So that counts.
Exactly. And that goes back to the narrow sex script, and thinking that sex only counts, or sex is only sex if it's some sort of penis and vagina, penis and anus penetration. And so again, going back to debunking that narrow sex script. But there are plenty of ways to orgasm. Clitoral is not just the only one. Penis ejaculation is not the only one. Some common other areas that are pleasurable, or what we call the erogenous zones, are the G spot, the A spot, which is anal stimulation, including prostate stimulation for males, nipple stimulation, and there are plenty of others. This is just a small little list. Myth number 11, if sex hurts, you should just relax and drink wine. I wish I could say that this was not a myth, or something that was still suggested in our community to both men and women who have trouble with pain with intercourse, pain or low desire, but this is something that constantly gets told to clients and people, that they should just drink wine and that they'll be able to have sex and send you on your way. I'm here to tell you that wine is not part of any of my prescriptions in order to increase or improve your sexual activity. Yes, wine can sometimes, or alcohol, or really any substance, may be relaxing or mind altering, but also alcohol is a depressant in the brain, and so eventually it will put the brakes on your desire, as well as if you have some shame around drinking alcohol or taking substances in order to have intercourse, that can also decrease your pleasure aspect of it. And really, it's just not a great suggestion.
You know, when you were talking, I've had conversations with other women who have mentioned painful sex, right? And they think that that's just a thing because of their age. And so they might count themselves out of having sex, or, you know, like stop it altogether, because it's just like, well, I've gotten older and it just hurts now, because that's what happens when you get older. You can't do what you once were able to do. But I'm glad that you talked about that, really both of you, because you're showing that there are solutions to the challenges that a lot of people are faced with throughout our aging experience.
For sure. One of the biggest things that I am passionate about as a medical provider is the underdiagnosis of genitourinary syndrome of menopause, which we used to call atrophy, but really that's a big fancy word to say that the tissues of the vagina become thin, they become friable, and it's because of that lack of estrogen, as well as lack of testosterone. And then that can lead to a whole slew of other events that Cole helps to work on, including bladder leakage, increased urinary frequency, tightening of the pelvic floor, loosening of the pelvic floor, all of those things. It's kind of like a sequela that happens when we as women are devoid of those hormones. And up to 80% of women will have this condition, but it is significantly underdiagnosed. We just chalk it up to, like you said, that's just what happens with age, and we just have to deal with it. And I tell people, just because something is common or normal, because that's what normally happens, doesn't mean you have to accept it, and doesn't mean you have to struggle with it. Like, we have ways to help with it.
And that's, I think, a big reason we wanted to have this conversation, is because oftentimes it's just simply not talked about. It's not addressed, and there are plenty of things that can be done. So just know that if you feel like in your healthcare wellness appointments that your concerns are sort of brushed off or blown off, or you're told to go just drink some wine and relax, to keep looking for answers, or for providers who are able to help you, and continue talking to your friends about it too, because they may know someone, but they're just not comfortable sharing the information as well. So the more we can normalize talking about sexual health as an important and normal part of your overall health picture, the better off everyone will be.
So this was a great conversation, and I appreciate both of you and everything that you contributed with your knowledge and expertise on sexual health. Y'all, next week is gonna be even better, because we're gonna be hitting points related to the G-spot and much, much more. So definitely tune in with us next week as we talk more about sexual health. Bye.
Bye.
Bye.